So when I started it, I said I'm going to stay very evidence-based medicine using protocols that have been researched and the way that we're supposed to do it from like the top societies that make our protocols and everything. So I want to stay true to that and trying not to, get swayed into doing things that may not be evidence-based because, a patient wants to try this thing. But for me, I'd rather educate the patient. It might just be an Instagram or TikTok thing. And I think that the main thing is I want to be able to be a good source of information for my patients and explain to them like, hey, I know you saw that there, but this is why it's not really a valid thing to do and why it might not be a safe thing for you to do.
Social media is the Wild West of all things health and nutrition. And so it is so important to make sure that people are getting guided, specific advice. I even say that in the world of finance, right? Everything needs to be really custom tailored and it can make all the difference because our bodies are so different.
Welcome to the Powerhouse Podcast for founders and leaders, scaling smart and thriving without burnout. I'm Nicholle Overcamp. Stay with me here and let's get better together.
Okay, my powerhouses. So if you are like me, and usually we are all more alike than we are different, and you have been fed up, frustrated about the medical system and what the experience has been like going to your primary care doctor and feeling dismissed or like the issues that you have aren't being heard and you are starting to feel like a crazy person. First of all, I can promise you, you are not. And when it comes to your health and your body, I am a massive, massive, massive advocate of making sure that you talk to the right people, find the right people who really, truly care and can help you feel better. Because without health, we have nothing, my friends. And so that is why I am so excited to bring Dr. Shikha Joshi on to the show today, because she is a brilliant primary care physician who stands behind solving the root cause problems and really making sure that patients are heard. She has been practicing internal medicine for over 10 years, and she's recently opened up Bloom Primary Care Direct to help provide patients with increased access to primary care and find real solutions. So, welcome to the show.
Thank you for having me.
Yeah, I'm so excited to just dive in and really learn what got you here, and especially practicing in the traditional medicine setting, if you will, for so long. I'd love to learn what was your impetus for starting your own private practice and what experiences did you go through to get to where you are today?
Yeah, so I had been thinking about creating a practice like this for a while, for about the past 3 or 4 years. I've noticed throughout my career, so I have been working in inpatient medicine mostly throughout my career. A lot of patients end up being hospitalized for conditions or exacerbation of conditions that could be better taken care of in the outpatient setting with better access to primary care as well as lifestyle interventions, really focusing on that preventative care, which unfortunately in the traditional insurance-based model, physicians just don't have the time to address all of these things, such as like diet, exercise, sleep, stress. Those all contribute a lot to a lot of chronic conditions. So with the insurance-based model, physicians are limited to, 15 to 20 minutes of an appointment time with patients, which you really just don't have enough time to, go through all that detail with the patient. So in my time as a physician, as also as a patient, I did notice this frustration on both sides when trying to navigate healthcare. So the direct primary care movement is it's a newer model, but it's working really successfully in other parts of America. I want to say everywhere, even as close as Rochester. And I noticed that Buffalo didn't really have that. There are a couple of hybrid clinics, but the true direct primary care model eliminates insurance completely. So I don't bill insurance for my services. That allows me to act and work directly with the patient without any of the barriers that are placed on physicians and patients in that insurance model. So this allows me to have direct contact with the patient and longer appointments, more frequent appointments without any barriers. And so that goes really well with the lifestyle medicine, which I am certified in as well. So the goal with that is to provide patients with that access and the lifestyle interventions, which I noticed was lacking over the past few years of my career.
Mm-hmm. Yeah, for sure. It definitely seems like, now when you go to see primary care, and because I personally believe this is not a fact, our insurance and medical system is so broken that it is very much hey, let's just check the boxes and get you through, and not really dive into some of the things that are really going on, unfortunately. And that said, you mentioned lifestyle medicine. I'd love to really learn what that means to you and how you're integrating those pillars into your patient care.
Yeah, so I decided to pursue the lifestyle medicine certification a couple of years ago. Just for my own knowledge, personally, I wanted to get better control of my own health, but also because I feel like it's just the basics of what we should be doing as physicians. And for a lot of conditions, like, when somebody's newly diagnosed with hypertension or diabetes, we always tell them, like, hey, work on diet and exercise, but we don't actually tell them what to do. And honestly, we're not really taught it in med school and residency. We touch on it a bit, but no one ever told us how to work out or how much somebody should be working out. And also just what you should be eating and why. A lot of it is just the why behind it. And that is there's a lot of scientific literature based off of this. So I got into it mostly for a personal interest, but also as I was doing that certification, I learned so much that I felt like, if I didn't know this as a physician and someone who has basically spent 10 years, studying this and learning all these biochemical processes, then, of course, the general population might not know this. I know there are people who are into the nutrition and physical activity, but also just learning about how that affects so many different disease processes that I see in the hospital setting and the outpatient setting. I just felt like it was something that is very valuable when it sounds so basic, but it really isn't. There's a lot to it.
There is. And I think there's so much confusion even around like what is best. There's social media is the wild west of all things health and nutrition. And so, it is so important to make sure that people are getting guided, specific advice. I even say that in the world of finance, right? You listen to all the finance gurus telling you what you should do, but they know nothing about you exactly or you specifically. And so, everything needs to be really custom tailored, and it can make all the difference because our bodies are so different. And, you touched a little bit in that you did this too for you and your personal health. Was there like a catalyst or an aha moment where you're like, oh my gosh, like I need to do more, I need to do better? And what was that for you? Because it's quite a leap to go from working in an institutional setting and especially the security that comes with that and being a physician to opening up your own primary care. And also, you don't have the security, if you will, of knowing that revenue will come in because you're not accepting insurance. So what was your catalyst? Because there definitely has to be like a bigger, deeper why than just like, I'm going to do this,
Yeah. So 4 years ago now, I was diagnosed with a rare autoimmune condition. And I think that was kind of, the point where I decided to change a lot of things. For myself. And also with that condition, I was navigating a lot of the healthcare system myself as well. And with that, I was tried so many different medications and different things, which, I still take medication and that works well. But I thought there's something that I would like to do myself to hopefully help control my symptoms, but mostly just feel better. And that's actually when I started thinking more about the lifestyle medicine certification, just reading things myself and learning about autoimmune conditions a little bit more. I think that experience in general, I was hospitalized for a while. I was seeing different doctors for a while. And just that whole experience, seeing it from the patient side from the first time was very eye-opening. So I decided, for a couple of years, I was kind of trying to figure out, what's the best way that I can use my experience to treat other patients and just, teach patients about what I've learned in my coursework or even just throughout my career. And so this direct primary care model seemed to be the best fit because I can operate outside of insurance and, provide patients with the treatment that I think is what they deserve and what's really important. So yeah, without having a business background or anything, that was another hurdle that I was, how am I going to start a business?
Yeah.
I haven't taken a business course since, grade 10. It was like accounting or something. I don't even remember.
Yeah.
It was so long ago. So I am very lucky in that the DPC, we call it DPC, the direct primary care community, is so helpful. I joined Facebook groups, read books, listened to podcasts, just learning how to put these clinics together. And then, of course, with the help of, my lawyer, accountant, I was able to gather all that information. And I just kind of started, last year, I just kind of started telling like my sisters, my friends, hey, I'm thinking of doing this. And they're all like, yeah, do it. So I'm like, okay, I'm just going to do it. So then I just did it.
I love it. You know what? Sometimes you just got to start messy, go blind, and then you'll learn, and truly that's exactly how I started too. I had zero idea what I was doing. Like I knew how to do the practice part, but starting a business, I thought I knew things, and until you get in there, sometimes it's just, you don't even know what questions to ask, right? Which is interesting. So what about your identity too had to shift for you from going from physician now to CEO?
I've never thought of it like that, like CEO, but okay.
You are, my friend. And founder.
Yeah, I think just the fact that I want to do it so much. Like I really want to do this. I would tell my husband every day that like, this is something I really want to do. So even he was like, just do it then, just figure it out and do it. And, he's been helpful too. But it's so different, the business side of things. Obviously the medical. And I think for me, I like learning new things, I guess. And so it was just nice to do something different that I have no knowledge about, but it was a different kind of learning. And I think that was actually very fun for me. I know it sounds really nerdy, but I very much enjoyed the whole process, even like making the website. I decided to do it myself because I just enjoyed that process. And I think it's also just having something of your own, which was really what motivated me as well. I think I just came to that point in life where I wanted to have something of my own.
That is fair, and I always say like, I rather fail and be in control of that versus somebody else doing it for me, right? Or not having total autonomy in terms of choices and how we're doing things, especially in fields of which are so deeply personal in the lives of other people. So I love that for you, and in doing that and in building everything, I know there's a lot of other private practices that are toying with the idea of not taking insurance anymore. I'd love to hear about how you address that and how you overcame the hurdle and the education behind how your model works and overcoming that objection I'm sure you get quite often in terms of being private pay versus dealing with insurance.
I really think that it was just, reading more about it, learning more about it, podcasts about other physicians who made that leap. That was very encouraging. There was a couple of podcasts I listened to every day on my drive to in and out of work or wherever I was going. And it was really encouraging to see other physicians who, like myself, have no background in business that were able to successfully create a practice. And I think a lot of us that do start the DPC are coming from the same place that, they just want to be able to have their patients have more access to them and just to provide better care. And honestly, it makes our job much easier when we can have that relationship with patients and really know them well. Yeah, I think just having the knowledge is so helpful.
Is there anything too that you have done as well in your education process or your social media that you have found really helpful that tends to resonate with people when they're thinking about coming on board with you versus the traditional medical system?
Yeah. So I think I forgot that part of the question, but a lot of people have asked me, why aren't you taking insurance? Why aren't you billing insurance? And I just kind of explained to them about the barriers that are placed on physicians and patients in the insurance model. And it kind of clicks because you don't actually realize it until you take a step back and look at what exactly is going on in that insurance model and how there are barriers, and explaining that there's people that get it and they're on board and they want to join. And some people, and, for some people, it might not be the best option for them either. Maybe they have really good insurance, or maybe they don't feel like they need to have a membership model for their physician, which is also fine. I think as long as people are getting the access and the medical care that they want and need, whatever model works for you works well. I think it's just being really confident in knowing what you're offering and how it can help patients, and just explaining that is really helpful. I will say though that a few of the patients that, they enrolled right away without really, initially, are people that have been waiting for a direct primary care clinic to open in the area. There's been a few that, they just, they enrolled right away from my website without any other questions or anything, because they have done this in the past, at a different location, and they already knew the value.
Yeah. And I will say I've been private paying for medical care for a very long time. And for me, it's so worth it, and almost ends up being a lower cost because you get to solutions quicker and you're not pushed around or on a 6-month waiting list or taking medications that you don't need per se because you're not having those conversations. So I've just appreciated the additional support, conversation, and literally learning about my body and how things work, so that you can feel better, because everything touches like your energy levels and what you're able to accomplish and do. And especially, I know a lot of the women listening are extremely high achieving women that have a very full plate, and there's so much that can be limited when you feel like shit, or, you're uncertain of what's even going on. So now being more in tune with your health and taking care of yourself differently, right? And healing your body. Are there habits that you have now that are non-negotiable and that help keep you grounded as not just a doctor, but a founder? And so your plate now is a lot more full. What are some of the things that you make sure you do to maintain your peace of mind, if you will?
Honestly, the main thing that I've done and stuck to over the past few years, working out, that's non-negotiable. And eating right, I would say like 90% of the time. So in the past, I would be like, oh, it's Monday, I'm going to start today. I'm going to start on Monday. Now my mindset has shifted in that, you do your best every day. And then I've actually, you found you can be a little bit more flexible. And I think it's just being a little less harsh with yourself. The other thing is working out. Like, I'm making sure I'm doing 30 minutes of cardio a day and some sort of strength training at least 3 or 4 times a week. I think I found that really helped with the stress levels for myself. And just in general, I feel like I feel so much better doing it. So those are the 2 things that have been consistent for me, no matter how busy we are, or if we're traveling or something. That's something that I've been pretty consistent with after, going through the past few years.
Yeah. Well, relatable, because those 2 things are my exact same 2 things that I do no matter what, or I literally can't feel human. And it's amazing when you stop how different you feel. Like, it's insane.
Yeah. We were traveling last week and I was like, we need to go to the gym. So even just like in the evenings doing we'll do like a 10-minute body weight exercise or something, you just feel better. And then we got back Saturday and like Sunday morning, went to the gym, and you just feel, I find that I feel so much better.
Yeah, same. Like, I feel very out of sorts if if my routine is off too, but I try when I travel to stick to it as much as possible, and like look at, we'll stay at a hotel or resort that has the better gym or some kind of classes that they're offering, just so that way that when your whole routine is off, there's those little things that are consistent, so you still feel decent. But then I don't know about you, there's nothing worse than coming home and feeling like garbage and you just lost like 2 weeks of traction, so and that does help too.
I think in the past I would feel like that, but even now, like, we go to resort vacations or like a cruise or something, and we always make time for the gym. It's helpful that my husband's also gotten into it as I have as well, so we hand off the kids and you have your hour and I have my hour.
Yeah.
But yeah, I think it's also like a sense of like, this is the one thing that I can control
That's
and
right.
I'm going to do, and no one can disturb me while I'm doing it.
Yeah, that's huge. I mean, and control the controllable, right? Because it's easy for the day to fall apart, but like as long as you can keep those small things to yourself and being disciplined about it and knowing that you matter enough to do it. And I mean, and shoot, like having your partner's buy-in and support on that is so helpful because, that way there's so much less resistance when you're trying to take care of yourself and everybody else at the same time. So, and is there something too along the way that you have had to intentionally say no to protect your model? So opportunities maybe that came your way or people who want to partner and you knew intuitively that even though it may sound attractive, you had to say no to stay true to the thing that you're building.
Yeah, I've gotten, like on Instagram or something, will message me and be like, hey, join our this. And it just feels very like salesy and it's not the vibe. So
yeah.
I have said no to things or, trying to join, like people have asked to join them in their, business or whatever it is. It's just not what I want to do. And so I have said no to a few different things because again, when I created Bloom Direct Primary Care, very much I felt like, it's my thing that I'm making and I wanted to run it the way that I want it to be. And so I think I'm a little protective of that I want to just keep it the way it's run.
Yeah. Well, it's huge and it's not always easy to do, especially when you're starting out and you feel like, what if I don't say yes to this, and oftentimes we're trying to do as much as we can to remain sustainable. So cheers to you for doing that. And I'm curious, did you establish a set of core values or rules that when you started the business that you promised yourself you would follow to help stay aligned with your vision and where you're going so that you didn't have those distractions when they sounded compelling?
Yeah. So when I started it, I said, I'm going to stay very evidence-based medicine. Everything I do. And this has been since med school residency that very much like we do things evidence-based, using protocols that have been researched and, the way that we're supposed to do it from like the top societies that make, our protocols and everything. So I want to stay true to that and trying not to, get swayed into doing things that may not be evidence-based because, a patient wants to try this thing. But, for me, I'd rather educate the patient on why this is not a real thing. It might just be, an Instagram or TikTok thing. And I think that the main thing is I want to be able to be a good source of information for my patients and explain to them like, hey, I know you saw that there, but this is why it's not really a valid thing to do and why it might not be a safe thing for you to do. So I think that was the main thing for me.
Yeah. Yeah. I love that. And as you've been building this and you're a mom and a wife, what are some of the things that you've had to sacrifice in making the choice to grow this business ultimately?
Yeah. So I have 2 little kids. They're 5 and 8. I think one thing was, obviously like I'm busy with them throughout the day, but basically my evenings were instead of, before when they were bed or whatever, that's like my free time. Over the past few months, like that time has been spent working on Bloom, but it's actually been enjoyable. So I don't even feel like it's like I'm doing a lot of work or, this is I have too much work to do. I try not to sacrifice that time with like family and kids. They do know, if a patient messages me that I am going to walk into another room and deal with that one thing and I'll be back. And it honestly just takes like 20, 30 minutes at most sometimes, but they're also very excited about the clinic and they go and into the clinic and it's nice for them to see me start something different. So it hasn't really taken away from my time with them. That was the other thing. I didn't want to do something that was going to take away time from my kids because a lot of my time when I'm working in the hospital, I'm there for 12, 13 hours a day. And I think that would interfere and I wouldn't get to see my kids some days just because I was at the hospital so late and they're by the time I get home. And so that was another reason I wanted to start Bloom is because I wanted to have something of my own that can be done on my time and the way I want to do it.
Yeah, for sure. And to be able to flex that is huge. You know, it might not ever feel like balance. And that word is like, I hate that word anyways. It's so much bullshit in it, but to be able to truly integrate, you know, and be fully present with your kids when you want to be. And then if you're working at 10 o'clock at night, who cares? They're sleeping. And, you know, to your point, like it feels fun.
My goal is, you know, I do most of it while they're at school. I think a lot of, you know, the timing really worked out too, because I started really working on it when my younger ones started full day school. And so that gives me the time to work on it while they're there, and then they're home, and, you know, I kind of put it away unless there's something urgent that comes up with a patient. I will, you know, tell them, hey, go play and I'll deal with this. But it's nice to be able to work on it from home and on my time, really.
Yeah. And I think it's cool that they get to see their mom build something, like, you know, in something to aspire to. You know, it's like they're at that age too where they're so impressionable in learning that. I love it. You know, my best friend, her parents own a business, and I, growing up, always watched that and watched what they did and how hard they worked. And it was so cool to be witness to how they grew the business, but then also the sacrifices that they had to make and the hard stuff that they had to go through. It wasn't all fun and games, but it was really cool as a kid to see all of that, because it helped me make better decisions too as an adult, and choosing and knowing to some degree what I was getting into and opening my own business. So I love that for them. It's super, super cool.
Yeah.
Nothing better than a strong mama. So, you know, and for you, like, what does success look like over the next 5 years?
I think, you know, getting my clinic to where I want it to be with the number of patients that I want. I'm hoping to grow it to initially 300 patients and then kind of seeing how it goes from there. And I think just really actually being able to give patients a better primary care experience. I think that would make me feel like what I've done was a good idea.
Yeah. And you're already like, it is a good idea. Right.
I think so.
More people just need to be aware of it.
Yeah. It's really just, you know, getting my name out there a little bit. Stuff. But, you know, it's been not really nice. I got a message today from one of my patients at like 5:30 a.m. with an urgent issue. And I woke up at like 6. We texted back and forth, and it was like dealt with by 7:30 a.m., which I'm sure for that patient who has to go to work, you know, and, you know, they have kids too and stuff. Having it dealt with, I feel like that probably, I'm hoping it made a big change in her day. And so, it does feel very fulfilling that you can actually really help someone when they need it.
Yeah. And that's huge. And even thinking about like the emotional burden now that she's not taking to work, that she's not worrying about or stressing about. And I think that in itself too holds so much value as to why your type of service is so important. You know, I mean, especially in women's health and all the wacko things that start happening in our bodies as we age, and being able to also have a human who has a ton of experience and expertise versus also going to WebMD or ChatGPT and going down the rabbit hole of like dial-a-death with some of your symptoms. I mean, that in itself is really tremendous peace of mind, and the level of service that you're providing, I think is really cool. You know, and because you're providing such a high level of service, have you had to really think about how to set boundaries as well with your patients?
So far, I haven't. That was one thing, because, you know, you want to be accessible to patients, but you also, you want to be clear about your boundaries. I tell my patients, you know, anything, you know, urgent, send me a message. And, you know, as soon as I get it, I typically respond unless I'm, you know, sleeping. But obviously if there's an emergency overnight, I tell them, go to the ER. And I'm also happy to collaborate with whoever they're seeing in the ER, any information or, you know, to discuss the plan or anything. But so far it's been pretty good. I've really enjoyed, you know, talking to my patients. Sometimes, you know, they'll send me something on Instagram and be like, is this true? And I'm like, no, don't follow that. Like, nice, because you develop like a bit of a friendship with them, and you just, you know, their style and they know my style. But it's definitely one thing that I do establish in our first appointment, what's appropriate to send me and what time. And also, hey, if you're having chest pain at 2:00 in the morning, do not wait for me to message you back. Go to the ER. Like, if it's something that I can't fix in the clinic, then you got to go to the ER.
And before we end, is there anything that you have is a message for the women listening that you hope for them to take away from this?
I would say if you have an idea, just try it. I would say just do it. I learned along the way, and I think I did probably make a lot of mistakes in the beginning, just learning, but I would say just do it and start. And I think finding people that are going to be like a helpful resource for you, just message them from, or talk to them. I found that people are very willing to, help you out or, walk you through something you don't really know how to do. And it's been really nice and helpful.
Yeah, I love that. Thank you. It actually goes so much with the quote I posted today about, doing something and failing is so much more beneficial than doing nothing at all. Yeah. Like just try, like what's the worst that's going to happen? It's so much better than thinking about it and never doing a thing.
Yeah.
So
I felt like I thought about this for a couple of years and then I was like, if I don't do it, I'm going to spend the rest of my life wondering why what could it have been if I did it? Yeah.
Exactly. And regret is the worst. So don't take that to the grave, ladies. Listen to the doctor over here, so thank you so much for sharing that. It's so profoundly important. And until next time, my powerhouses, continue to be courageous.